Let's talk about two dangerous Medicare tricks that some agents are using to manipulate you. And they aren't just little mistakes, they are full-blown insurance fraud.
Could be bad.
The scary part is, if you fall for them, you could end up losing your plan or being stuck paying back all of the medical bills that you had out of pocket. So don't let this happen to you. Stick around and learn how to spot these two traps. Well, I'm sure you're probably wondering, how the heck can I commit insurance fraud while on Medicare? Well, in this video, I'll go over two ways that some Medicare insurance agents are trying to get you to commit insurance fraud possibly, why they're doing it, and how you can be sure to steer clear of their fraud games. The first fraud I want to look at is lying for medical underwriting. There are many insurance agents out there, especially here on YouTube, that only sell Medicare supplement plans. They don't have the certifications to represent Medicare Advantage, or they don't have to follow the same rules that those of us who work with Medicare Advantage and Medicare Supplement, all of the options. They don't have the same rules and they don't have to follow the same rules that we follow. This is because Medicare supplement plans are generally less strict when it comes to their requirements, and there is essentially no certification. You can just sell a Medicare supplement plan as soon as you have an insurance license. And that's why a bunch of people who can only sell Medicare supplement plans tend to be online or on YouTube. It's pretty easy to spot these people because they really go out of their way to bash Medicare Advantage plans and try to make it seem like it's a terrible option for all people. And these guys try to do whatever they can to get you to switch from a Medicare Advantage plan to a Medicare supplement plan that will pay them a commission. However, these guys sometimes run into a problem. You see, it's not easy to switch from a Medicare Advantage plan to a Medicare supplement plan if you're past your initial enrollment period or don't have a special enrollment period for Medicare supplement plans. Because outside of these periods, you'll need to medically qualify for a Medicare supplement plan in most cases. What this means is that the insurance company that has the Medicare supplement plan is going to give you a bunch of health-related questions. And if they're unhappy with your answers for any reason, they can either raise your premiums or just outright deny your application. This is why if you have some sort of health condition like cancer, or you've had a recent heart attack, or you have been hospitalized in the last year or two, or you have an upcoming procedure, or if you're taking medications that are expensive, or that say you have some chronic condition, it's very likely that the insurance company will decline your application. And this is where fraud can come in. If you can't pass underwriting, then sometimes these greedy sales agents, they're not going to make money off you anymore, so they will tell you to lie on your application so that you can pass medical underwriting. Now, I want to be very clear about this. Never do that. That is fraud. If somebody suggests to you that you should change your answers or that you should answer things in a certain way that's not 100% true when it comes to medical underwriting, run away. Honestly, this is just not something that you're going to get away with very easily. There's a lot in your medical record that's going to show otherwise. You might not realize, but your medical records are mostly kept electronically, and most Medicare insurance companies are going to check your records to see if they match your answers. They're able to see all the prescriptions that you've taken and some of the other tests and things that have been ordered for you. So they can also, in addition to that, go and ask your doctors and get clarification on the questions that you've answered. Sometimes the records might get it wrong, but most of the time, Medicare supplement companies can tell if the person is lying. But okay, if you haven't had the surgery you scheduled for yet, do you really have to tell the insurance company about it? Well, the answer is yes. Because even if the insurance company accepts your application for Medicare supplement at first, they are legally allowed to make you pay for it if it happens within a time frame, or potentially even terminate your plan if they discover that you had this procedure planned all along and you lied on your application in order to get the Medicare supplement. This obviously puts you at a very high out-of-pocket risk because you could have to pay for the entire procedure because your insurance company can simply decline it, saying that you lied on your application. Now, I said entire procedure. I want to qualify that. I mean that you would have to pay for your entire portion of that procedure, because without a Medicare Advantage plan or a Medicare supplement plan, you're responsible for paying the 20% of the anything under Part B out of pocket. So if you have a $10,000 procedure, then that means you have to pay $2,000. If it's a $50,000 procedure, well, you're going to have to pay $10,000. So you don't need me to tell you about how much procedures can cost. I mean, there's a lot of procedures that can cost way more than $10,000. Now, to make matters worse, If your Medicare supplement plan terminates you, it's not likely that you can join another plan at any time. Most Medicare supplement plans won't take you anymore because of your health condition, and they can also see that you were declined by another insurance company. And even if you want to join a Medicare Advantage plan instead, you have to wait for the next annual enrollment period, which runs from October 15th to December 7th, or have some qualifying special enrollment period. So that's why lying on your Medicare supplement plan application is extremely dangerous. Don't let anyone tell you or talk you into doing this. If someone even suggests this, like I said, run away because they don't have your best interest in mind. They're just trying to get paid. Remember that lying on an application for insurance is fraud, and you could find yourself in a lot of trouble for it. Now, before I get to the second way that you might be committing insurance fraud, let me jump in here and say that if you're finding this helpful, please leave a like. This not only helps our channel, but it also helps this video to reach other people who need to hear this message. Okay, let's get back to the video. The second way that you might be committing insurance fraud is when you fake an address. Medicare supplement plans have standardized coverage. This means that it doesn't matter which company that you have your plan from, it will provide you the same level of coverage as other companies selling the same type of plan. However, what is not standardized is the price that you pay for your plan. Now, the price depends on several factors like your age, whether or not you use tobacco, and here's a big one, where you live. That's right, the cost of a Medicare supplement plan varies greatly from state to state and even county to county, and sometimes just from one zip code to another. And as you can see from this chart here, in some states, the cheapest plans are only about $100 for someone who's 65, but in places like New York, the lowest price is almost $300. Now, Medicare supplement plans are accepted all over the country. So if your doctor takes Medicare, they should also take your Medicare supplement plan. So even if you live in Los Angeles and you enrolled in a Medicare supplement plan there, your plan will still cover you when you go to New York. And this is where the fraud can come in. Because Medicare supplement plans are so expensive in some states, some people try to use a fake address to get a cheaper plan. They'll try to enroll in a cheaper state even though they don't actually live there. Some people also try to use this same trick if they're moving from a state where the Medicare supplement plans are inexpensive to a place where they are more expensive. When you move to a state, you generally don't need to enroll in another Medicare supplement plan. You just need to inform your insurance company that you're moving, but this will affect the price that you pay. Because of this, some people don't tell their insurance company that they're moving. They do this because they want to keep their original price for their Medicare supplement plan instead of adjusting to the new state that they're moving to. Now, ladies and gentlemen, this is fraud. If you're caught doing this, you probably won't lose your plan, but it's very likely that you'll have to pay for the months that you were using your plan at the reduced rate. And that's why you should just do what's right and always use your real address. Besides, keeping the lie is going to be difficult. Your insurance company will notice that you're always getting services in your new home state, and they might investigate that. In addition to that, they may get information from Medicare that tells them that your address with Medicare or Social Security has changed. Also, if you're enrolled in a Medicare Part D prescription drug plan, you also need to make sure that that changed to your new location because those are also location-based, and Medicare will alert your Medicare Part D prescription drug plan if you move or change your address. Now remember, drug plans also have networks, so you could be in a situation by not changing your plan where you have a hard time finding a pharmacy that takes your plan. Although that's less common because oftentimes pharmacies use these national networks. That's why if you live in an expensive state, don't lie about it. Not only is it fraud, but you're going to have a hard time getting away with it anyway. And those are the two most common ways that people with Medicare supplement plans may commit fraud without even realizing it. And to prevent this, just always be honest. Don't hide from your insurance company because there are ways that they can find out that you've moved. And even if you find an agent who encourages you to lie, run away from them as far and as fast as you can. They're only looking after their pockets, and they're going to lead you into a lot of trouble. Now, if you want to learn more about medical underwriting and the process for that, go ahead and watch this video over here. In it, I show you some of the real examples and samples of medical underwriting questions and talk to you about the things that you need to know when considering enrolling and going through medical underwriting for a Medicare supplement plan. So go ahead and check that out, and I'll see you next time. Bye-bye.